Hi everyone, and welcome to Truth Over News. Have you ever wondered what the real purpose of lockdowns was, or why they weren't immediately ended once it became obvious that they weren't working? In other words, why did 15 days to slow the spread keep getting extended? And then once lockdowns were eased, mask mandates took their place everywhere, despite the fact that all the evidence said that masks don't work. Why did that happen? And why did every single institution, from government to the media to universities and big tech, not only push lockdowns and masks, but also censor anyone who didn't obey? Well, it might all have to do with the so-called mRNA vaccines. January 13th, 2020 is a very important date in the sequence of events that brought us lockdowns, masks, and the experimental so-called vaccines. January 13th, 2020 was a Monday. The previous day, the Kansas City Chiefs had won their divisional round game on their way to winning the Super Bowl a few weeks later. The stadiums were filled to the brim and no one had a care in the world about a mysterious virus that had recently leaked out of the Wuhan lab. In fact, a day later, on January 14th, 2020, the WHO announced that this new virus didn't even transmit from human to human, so nothing to worry about. Well, while people were happily going about their lives and the WHO was claiming that all was well, someone did something very strange, something that doesn't fit at all with the idea that everything was fine. And that someone was Anthony Fauci. We unearthed an SEC filing in which pharma giant Moderna admits that on January 13th, 2020, Fauci and Moderna agreed to go ahead with mobilization towards manufacturing the so-called COVID vaccines on a mass scale. Wait a minute, how's that even possible? January 13th was a mere 13 days after information leaked via Taiwan that there was a new virus in China. And January 13th was a mere 2 days, yes, 2 days after China disclosed the genetic sequence of this new disease. How did Fauci and Moderna go from a genetic virus sequence, which basically means a collection of 30,000 pairs of A's, C's, G's, and T's, which is an instruction manual for building a virus, to a so-called vaccine? In other words, how do you get from a collection of 30,000 pairs of letters to vaccine production mobilization in less than 48 hours? Well, the first part is pretty easy to understand in the brave new world of biology. That means the same brave new world of biology that brought us the pandemic. All you need nowadays is a collection of letters which are then fed into a machine, and the machine will spit out a so-called vaccine based on those letters. What does that mean in detail? Well, viruses have spike proteins that dock with cells. In COVID, that spike protein has the infamous furin cleavage site, which makes the virus so virulent and pathogenic in humans. What this new mRNA technology does is that it introduces messenger RNA, hence mRNA, into the body. The RNA is a sequence of letters that corresponds to the virus's spike protein. And the messenger part, well, that means that a message is passed to the body on how to build that spike protein via the RNA. Okay, so once the mRNA is introduced into the body makes this foreign spike protein. And then the body's immune system recognizes the foreign spike protein as something that's not right. And it learns how to produce antibodies for that spike protein. And then if someone catches the actual virus, the immune system is already trained for the virus's spike protein, and it can immediately respond, thus making sure that you don't get sick. Well, that's the theory anyway. The second part, meaning the immediate mobilization on January 13th, 2020 to make this stuff in huge volumes, well, that part is a bit more complicated. And this gets us to the issue of why COVID was so important to the mRNA crowd, by which we mean both the pharmaceutical giants and people like Fauci, who staked his entire career on creating super vaccines super fast. mRNA technology was developed in the 1960s and 70s, but it wasn't deployed because RNA is inherently unstable. Unlike DNA in humans, which sits on a double helix, meaning two intertwined strands, RNA only sits on one strand. But viruses use RNA, not DNA, so the challenge was to make RNA less volatile. Recent advances in nanotechnology meant that the RNA could be packaged in fatty bubbles where it would survive until it reached the inside of human cells. Completion of that technology, called lipid nanoparticles, was only accomplished in 2018. And the timing is extremely important here. So in 2018, drug companies and people like Fauci finally had the keys to their promised land, a way to get mRNA inside human cells. But what would give them an excuse to do so on a large scale? Previously, an mRNA drug had been developed against Ebola, which, with the new nanoparticle technology, could have potentially been delivered into humans. But Ebola is a disease that does not infect millions or billions of people like, say, COVID. It's also mainly found in Africa, which isn't exactly a lucrative market. And there was another problem. Although by 2018 pharma companies had the technology to deliver this stuff into human cells, there were no long-term safety studies. And there were other problems as well. So-called mRNA vaccines can cause a lot of havoc in the human body. Without getting too technical, if a human cell is tricked into making these virus spike proteins, something else happens other than the body learning to make antibodies. And that is that the immune system also attacks the cells that are making this foreign spike protein. That is why it is so important that this mRNA stuff does not get pumped into your bloodstream, where it can spread to every part of the body. Because if it, say, spreads to the heart, and if heart cells then start making the foreign spike protein according to the mRNA instructions, well, then your immune system will start attacking your heart. That's very bad, and we've obviously heard of many instances where exactly that has happened. So this mRNA stuff is only supposed to go into muscles, and it is not supposed to be injected intravenously, meaning into veins. Well, sometimes things go wrong, but let's assume they don't go wrong and the mRNA shot just goes into the muscle in your arm. Okay, so the muscle makes the foreign spike protein and the human immune system makes antibodies as well as attacking the muscle. So you get a bit of pain in your arm, and that's that. Well, ideally, yes, but this is where it gets really bad. It was known right from the start of COVID that intramuscular vaccines, that means vaccines that are injected into muscles instead of veins, cannot induce immunity in airways. But airways is how COVID spreads. To put it simply, mRNA vaccines were, by their very nature, never able to stop the spread. It was always impossible, both in theory and in practice. Yet that was the excuse used to force everyone to get injected with mRNA to stop the spread. A paper that appeared in Nature magazine last month spells it out in stark terms. Intramuscular vaccines cannot induce immunity in the mucosal tissues of the airways, which is the site of SARS coronavirus 2 entry. So, despite the discovery of the lipid nanotechnology in 2018 that allowed delivery of mRNA into the human body, there were still a lot of problems. Safety, effectiveness, damage to other body parts, long-term effects, and so on. There's no way that this mRNA stuff would have been approved for repeated use in billions of people, and certainly not for a very, very long time. We're talking many years of testing. And then the end result may have been that the mRNA technology would have been deemed to be too unsafe to be used widely, or it would have been found ineffective. Well, the drug companies didn't want to wait or risk rejection, and neither did Fauci. So when COVID appeared on the horizon, they immediately jumped at the opportunity to use COVID as their vehicle for pushing mRNA onto the general public. We were the guinea pigs. all of us. There's no other explanation that fits with the fact that Moderna and Fauci were locked and loaded on January 13th, 2020. We can also add this little clip from the World Economic Forum, where the CEO of Moderna, a man called Stefan Bancel, told everyone that he knew that there would be a pandemic.
So the great news versus 2020, where we are today, is we have manufacturing capacity. As Seth knows, when the pandemic happened, Moderna had made 100,000 doses in 2019 for the whole year. And I remember walking after Davos into the office of my head of manufacturing, and I say, how we make 1 billion doses next year? And he looked at me a bit funny, say, what? I say, yeah, we need to make 1 billion doses next year. There's going to be a pandemic.
You heard it straight out of the horse's mouth. We need to make 1 billion doses next year. There's going to be a pandemic. Now, does that mean that Moderna knew that the Wuhan lab had leaked COVID into the world? We don't have any evidence for that. It's more likely that with the development of the mRNA delivery systems, these guys were all itching to release their supposed wonder drug and were just looking for any excuse to do so. As we said earlier, all they needed was the virus sequence, which they fed into a machine, and like magic, there was the mRNA just waiting to be deployed. But how does one circumvent the need for proper safety testing? Well, with the mass psychosis stirred up through the media and their fear-mongering, as well as the lies from people like Fauci, it was pretty much guaranteed that the public would demand a wonder drug and that they wanted it fast. Remember all the polls that showed that people had a hugely exaggerated expectation of risk from COVID? Here's a Gallup poll from 2021 which shows that many Americans, especially Democrat voters, overestimated the risk of COVID hospitalization for unvaccinated people by factors of 50 or higher. Death was also extremely overestimated. This was the level of hysteria that was cooked up over months, and it set the framework for skipping long-term testing and for the super fast rollout of these so-called vaccines. And then there was also leverage. While one could argue that the original 15-day lockdown was perhaps worth trying, and we would disagree based on the fact that all pandemic plans had rejected the idea, well, even if one thought, let's try it, it quickly became obvious, to most straight-thinking people anyway, that lockdowns weren't working. But Fauci kept pushing, and lockdowns kept getting extended. Add to that the mass school closures, business closures, and so on. And then on top of all that, mask mandates took hold. Everyone had to wear a mask, pretty much everywhere. Again, despite all the evidence saying loudly and clearly that masks do not work. So what was the point of lockdowns and masks if they don't work? Well, for one thing, the point was to fearmonger, to keep up the mass psychosis which had affected so many people. But there was another motivation, and that was leverage. Not having to be in lockdown and not having to wear a mask could be used as leverage to force people to get injected with these so-called vaccines. Let's hear it straight out of Biden's mouth.
If you are fully vaccinated, you no longer need to wear a mask. But if you've not been vaccinated, or if you're getting a 2-shot vaccine and you've not gotten you only had your first shot, but not your second, or you haven't waited the full 2 weeks after your second shot, you still need to wear a mask.
There's no doubt about it. Lockdowns and masks were used as leverage to force people to take these mRNA shots. And given the extremely early start date for the mobilization of these so-called vaccines on January 13th of 2020, there's also no doubt that Fauci and his pharma friends were just itching to unleash this stuff on the public, irrespective of whether it was safe or effective. And then on top of all that, given that delivery of the mRNA shot into a muscle was never going to stop the spread, we have all the ingredients for a scandal of epic proportions, one which is only starting to dawn on the public now. Thanks for joining us in today's episode of Truth Over News.